There you go.
Okay, this is a meeting of the Board of Health, Thursday, January 6, 2022, 7 p.m. We're meeting held pursuant to Chapter 20, Acts 2021, holding a hybrid meeting with limited technology until new equipment comes in the future. In the event of any technical difficulties, we will ensure a recorded tape of the proceedings is placed upon the town website after the meeting. In the event of a closure of the town hall due to inclement weather or any other emergency, the hybrid format shall switch to remote meeting Zoom only for the posted meeting. In attendance is Sue Graska.
Jean Nelson.
Mackenzie Kane.
Tom Fitzgerald.
Okay. Public comment. Is there anybody on for public comment to discuss something that's not going to be discussed tonight? Is anybody there, Peter, or anyone else?
Asked to unmute, so that means that she's asking questions?
No.
No.
Just leave him alone. Yeah. Everybody
how-
that signed in is on.
No, I know, but if they want to talk.
Yeah, they can.
No, no public comment from anyone?
Nope, I'll wait to ask any questions.
Okay, so we have minutes from the previous meeting. Hopefully no changes because I'm not real good at them. Mackenzie, what do you think? Were they okay?
Yeah, I reviewed them and I thought they were pretty thorough and covered our meeting. Yeah.
Okay.
I'm going through them. I haven't
Go
quite
through-
finished yet.
That's fine. Go through them. Tom, do you have a copy? Jean, is yours a two-sided or one-sided?
One.
Yeah, Tom, go through them because you probably have stuff too. All right, so Jean and Tom are reviewing them.
Housing complaint at 71 Klein Road. Tenting occupancy.
What do I have?
You have tenting on vacant property,
Yeah,
so
that
it
was a
should be
complaint, yeah. no.
occupancy, not just the tent is on there, that somebody's living in the tent.
But
Oh, that's Vicky.
I know.
Yeah.
Jean, yeah, but, you know,
If there's other changes. Actually, it's a trailer. There's a trailer there. Not a tent. So I
no,
should
the
fix it.
trailer is 810 College Highway. This is 71 Klein Road.
No, there is a trailer there
There is a trailer? Okay.
in the back by the woods. There might actually be two, I'm not sure.
Fred's Cafe is actually Red's.
Yeah, no, make the corrections, it's fine.
Scheduled with, it should be with all the towns involved.
Then fix that Klein Road too, that it's a trailer.
Okay.
I mean, it might be a tent too, but I think it's a trailer, maybe one or two.
The on us of contacting,
Onus,
it's onus. It separated it, the word, and turned it into on us. Okay.
Return those back to you, sir. That's how many
so
corrections I
what-
had.
what
Yeah,
do we
just
have?
those few
It's just
small
red.
corrections.
So do I have a motion to,
I'll make a motion to approve the minutes from the meeting of,
I'll second that motion.
Second.
all in favor?
Jean Nielsen, yes?
Mackenzie Kane, yes.
Sue Broski, yes. Minutes. Okay, first of all, Tom, how are you doing?
Doing well.
Yeah, he is, he's fine.
Okay, so
He's fine.
ready to give your report?
Yes. Welcome, everybody. First orders, as you know, we received antigen kits, rapid kits for home testing, and I'm happy to say that we've dispersed all the 18 boxes to various locations throughout the town, including the Council on Aging, library,
Did I even put that in the,
police and fire.
did I even put that in the minutes? They were gonna disperse them?
No,
No, all right, well, we'll put them in these minutes, so let me.
We had a lot of calls for people that wanted to, they had read about it, in the newspaper, in the
Where's the-
media.
Where's the Council on Aging as opposed to the senior center?
That's the same
it's
thing.
the same thing.
Yeah.
Okay, I'm gonna write them all down. Senior center,
The police
Police,
and fire,
fire,
police,
town hall.
Met fire,
schools,
all three?
yeah.
Well, I went to the superintendent's office.
Oh, so you-
Almost all the churches that I could get a hold of.
So you went to the superintendent's office?
Yes,
Okay, which churches?
I haven't written down. I don't really have everything, but the church next to the open pantry, the Southwark
Is that the
open
Methodist one?
pantry, yeah, they declined. And I
Did you
couldn't
do
get a hold
two-
of
did you do the
the
other
church, yeah, and I couldn't get a hold of, there was no answer any times I left messages.
On the
I couldn't leave a
congregation-
message,
on the
they wouldn't
congregational?
answer. The one across my BS, that was also,
Oh,
I
that
tried to
one.
contact
Yeah,
it several
that's right.
times.
Okay, I'll just say some of the churches.
And the library. Um,
So did we actually give some out here at the town hall?
Yes. all
Yes,
the
to the
employees.
employees, yeah,
Okay, employees of the town hall.
and police, fire, public works.
DPW. Open pantry?
Yes. And just as an addition to that is that we're hearing that there are going to be combis, which is a Massachusetts Commonwealth purchasing, bulk purchasing for towns are going to be allowing us towns to purchase additional antigen tests,
Purchase, or are we getting them free of
No.
charge?
purchase, but at a much reduced rate from places like the pharmacies that have them now.
Yeah, but they had in the news that people will be able to get reimbursed from their insurance companies for the cost of the test.
Okay.
So,
Depending what your deductible is.
no,
Okay, so what company are we can get them from?
Oh, there's a few. It's
And
combi, so
So how does this work? If the town wants, and would the Board of Health purchase it? Would the selectmen purchase it? How would it work?
I think that's it's still in process, but it looks like the Board of Health is going to the Select Board is going to authorize various departments if they want to, like police and fire, if they have a need to purchase them on their own and just get reimbursed through the budget, as I understand it.
Okay, so should I even put that in the minutes? I'm not quite sure how to even word that.
But we're just maybe that we're looking into options of buying bulk antigen test kits to the town through the Commonwealth buys. That's what the website is for towns, cities and towns in Massachusetts to purchase additional ones. But my understanding is that we know other free antigen test kits, like we had the 102 towns that received them, and Southwark was one of them.
Okay, so why did I think that the federal government was gonna inundate us with kits?
Because President Biden indicated that he would be doing something in January, 500 million kits.
So we haven't heard any more of that.
No, I think there's a shortage too about getting that many kits at one time. So that's in process.
So these kits that we just recently got,
Yes.
how many total was it?
18 boxes at 3,400, I believe.
34. And who did they come from, federal or state?
Everything's coming from the federal, just gets shipped through the state.
They're from the federal government.
Yeah.
34 tests. Or 34 test
3,400,
kits,
18 boxes,
test kits.
180 per box.
So do we know if any of these places that you distribute them to still have any?
I believe they're all, I believe, no,
They're all
No.
gone.
no, because people have been calling and everybody's out. They got rid of it pretty quickly. It is,
Do we know of any, the stores in town, CVS, Walgreens?
I heard CVS still has them.
I believe Stop and Shop were advertising. One of the bus drivers came in today and said, oh, and and they're at a reduced price of $9 or something like that. There's out there.
And they're different manufacturers? They're not all that same manufacturer that we have, do you know, Tom?
There are different manufacturers, yeah.
Different manufacturers,
Yes.
okay. Okay, so I guess that's it for that, we just.
And again, there'll be more ordered. I'm talking to Carl about that. What if I should, I can bring up that now about I sent information to you folks previous to discussion of possibly having a testing site here, town hall. We had a meeting with Carl and the other department heads that were involved with it, potentially involved with it. And I reached out to a company in the eastern part of the state called RN Wellness. RN Wellness, RN, like registered nurse wellness. It's national, but they just happen to be located in North Shore. They have offered to as they're part of their business model to come out and set up a site, antigen testing site, using either the PCR test when it's available, and I'll get to that in a second, and or the 15-minute antigen test. Okay, so we were working out and looking at the logistics of where that could be located, how it can be done smoothly, and when it could be done. So if we gave the authorization right now, and it would have to be through the select board as well, it would still be 2 weeks, 3 weeks.
Thing is, if it's gonna be an antigen test like we gave out now, what's the point? Let's have a PCR test. Do they have a little point of care PCR testing thing?
Here's the theory that's the woman that's running it told me. Right now, PCR testing has been, they can't assign new PCR testing because they're so backed up, the labs, because it goes to lab. So, but she did say that they anticipate within 2 weeks, or the time we could theoretically get the site up and running, that they would be back online to do the antigen and or the PCR.
Eastfield Mall, is that PCR or is that?
I think it had been
I think it's
PCR, yeah.
PCR.
yeah.
Yeah, I would opt for PCR rather than antigen testing. They can go get a kit and do it.
Yeah, that's why we're thinking about purchasing. But there was some people are saying they can't get into some of these places like the Eastfield Mall. There's hours of wait.
Well, no,
So-
I think the testing site would be good, but
Yeah.
PCR. I looked at the antigen kits and I don't see anywhere where it talks about the sensitivity or the specificity in the directions, so I don't know how good it is.
It's an indicator.
Yeah, and if,
I mean, it's a screen,
if,
but,
exactly,
but-
it's not a
what's-
PCR.
but
for
what is
sure.
is it 70% sensitive? Is it 50%
Good-
sensitive?
it's a good
You know,
question.
It would be nice to know. I don't think it's that.
And also how fast is it decaying? I don't mean when it runs out from, when it expires, the date use expires. But also after you do the test, 2 days later, 3 days later, you could be, just because you're testing negative, it only has a useful life expectancy of the day you're testing it.
Yeah,
You
it's
know,
just-
I
it's
mean,
just
so
a-
it has a limited,
It's
yeah,
just a snapshot in time.
it's a snapshot in
I
time,
know.
right? So
Well,
you,
the same with the PCR, it's just a snapshot in time.
exactly.
Right, so. Okay,
So, so just to kind of put a cap on this, the woman that I was working with, Corinne, from RN Wellness, said that they were so inundated, and you might find this not surprising, but they were so inundated, and it's a national firm. They are halting any new sites. But she said, since you had already contacted me last week, we are okay to continue with you, but we're not accepting any other applications for sites. Okay, now the other issue with that firm was that they historically were doing inside testing, going inside. And some other towns are doing that, and they've even had some at town halls. She said, I know East Hampton was doing that. They're an associate, they were working with Northampton. And they were doing it inside first. Now, apparently, they've moved outside.
So they just do it in the car as you come up.
Right. So I called her back because we discussed that about, because it was so close to the Council on Aging, there was some concerns about having people in that were potentially positive inside the building. Well, a couple things. So the person, RN Wellness, said that she would check with her bosses and see if that's a possibility. She said she hasn't run one yet, but she's run one indoors, so there would be a little more logistics, including police, security, which we talked about today at this morning's meeting. However, it's very flexible timing for them. If we want to proceed with this, they could do it in 5-hour blocks, and because the town hall is obviously open during the week, there would be one option we talked about was like 2 to 7 during a weekday and into the night, or a weekend. They can roll 7 days a week, this company. So they get local help. They get people locally, even though they reach out to people and get them locally. They set it up. They bring their computers in, and they just need a place like the town hall, but not necessarily not bringing the people in. But certainly if it was on a weekend, other than, some people would have to be there besides them, it wouldn't be an issue with traffic as much. You wouldn't have people going into town hall. The Council on Aging wouldn't be in there. So there is some pluses about having it a weekend.
How does this get paid for?
Oh, that's the beauty of it. It's paid for with federal funds, CARES money, except for those small costs of the police security. So no, it's no cost. I should have mentioned that to begin with. Yeah, I think I mentioned that, and I sent you an email. I sent you emails on that. Yeah, yeah.
It is no cost except for police and stuff like that.
So I'm still waiting to hear back from her if she got from her superiors whether they were able to even do that. Then it would be a couple of weeks before. So I'll keep you all posted if you're on board. If you want to vote tonight to consider it conceptually, I mean, if it doesn't work out, I still have to take pictures of the site and send them back to them because they have to see what they're getting into. So this is not 100% done deal by any means. I want to make sure everybody's comfortable with what's going on, including the select board. When Carl was there at this morning's meeting.
And it would be open to Southwick and other.
Well, we discussed that. got some options there too. It would be all by appointment, no walk-ins. But we were thinking also of the Southwick Talent Regional School, Granville and Talent. Because they have to have a minimum of 200 a week, which doesn't seem too daunting, does it to you? 200 tests a week?
No, but who's going to be the contact to sign up? How do you sign up? Who's?
Oh, well, we would get more information if they don't have, they
Right.
handle that, yeah.
Oh, they
They,
handle
oh,
the
yes,
sign up?
yes,
Okay.
yes, oh, yeah, it's just, they
Yeah,
roll
because we
in.
have no personnel here in order to sit and answer 200 phone calls. and
Oh,
sign
no,
people
we
up.
discussed it, it's good question, no, we discussed that, it would absolutely, no, we're not gonna tie up our people, they come in and do it themselves, and where
Okay.
people have insurance, they would use insurance, but if they don't, then they get it anyway.
But we still have to do the logistics of doing it outside, collecting specimens,
Yes,
and it's winter time.
yes, and we still gotta get that company's approval, and if for some reason that doesn't work, there's other companies that do this. And I'm sure though, because of the increase in the number of people that are needing and wanting tests for a variety of reasons, that, those other places, for instance, Curative, that's in Westfield at Westwood, they do the similar thing. It's very similar, another company.
So is this something that we have to, or you have to pursue with, if we go with it with Carl for the logistics, how to set everything up and,
We got police, yeah, we got, issues of,
and are the selectmen
Times.
on board with it? Or do
excuse me? Yes,
we have to present it to the selectmen, if the selectmen are on board with it?
conceptually, in other words, we have to work out the nitty-gritty details, but yes, conceptually they are, yes.
Okay,
But
so,
the actual when it's gonna happen, where it's gonna happen, inside or outside, it appears that we're leaning toward outside with their staff, inside, of course, with their computers,
yeah,
in a secure room, they can lock stuff up, and you have medical records then, so they have to make sure that those are contained safely.
any other towns in the area have used them?
No, Curative seems to be the one in the area, but that I'm aware of. That this is not Curative, this is RN Wellness. But I have reached out to Curative as well, and they
What do
just
they-
got back to me. Yeah, I reached out to them a week ago. They just got back to me because they're so busy too. So, who knows if they were even taking new sites.
Okay. So, I can make a motion, right? I
You
make a
can.
motion that Tom pursue this testing clinic with RN Wellness. Do I have a second?
Yeah, on a conceptual basis,
Well,
you
yeah,
know, you make sure the logistics
to get a proposal.
can be, all worked out. Yeah,
Okay.
then I would second that motion.
All in favor?
Mackenzie Kane, yes.
Green Nielsen, yes.
Sue Broski, yes.
Next,
It's here I'm trying to take the minutes, so.
Sure.
you find,
Thank you.
Sue,
Yes,
instead of doing all that,
yeah.
that's all you have to do is listen to the recording and type
Yeah.
the minutes to the
Yeah,
recording.
I just want
I
to,
found that to be
easier.
Easier. Yeah.
Yeah, no,
You know,
I don't want to sit down and listen for an hour and a half or whatever, 2 hours. I'd rather just write it. Okay, continue with your report.
Yes,
Tom?
okay, the housing complained at 16 Congamon Road. I investigated and it was confirmed that there was an issue with materials outside.
So debris,
A lot of things, junk, rubbish, and it's owned by the Southwick Housing Authority. So I contacted them and it's been cleaned up.
okay,
Signed off 18
Wait a
Shagbark and CLC certificate of compliance issued. Sign off to Silvergrass. Sign off 8 Silvergrass. Sign off 51 Hastings Road. Sign off 264 Feeding Hills Road. Final inspection lot 6, house number 35, Mort Vining Road,
36?
36, yeah. Used to be lot 6, 36 Mort Vining Road. Food service inspection at Red's Cafe, formerly Red Riding Hood's Basket. No date of opening yet. Everything went fine. The pool inspection, Wilderness Experience. I sent to you via email the draft. I made some comments on the job description for my position, and I think you may have had that in your email. If not, I can provide you with copies of that.
Do you have that, Mackenzie?
Yeah, I quickly reviewed it.
So basically, on page 2, you talk about special knowledge abilities for the position. Instead of saying, you know, RS and SC and all that, we're just gonna say eligible.
Well, that's my recommendation.
Yeah, eligible, and change it to the ability to acquire and be able to acquire. And then we'll cross out the master's degree. Do you or anybody have this in the computer?
You must. Yes, I think you sent that the original one to me. Yeah. I think you had it
Do
on
you have
yours
it,
too, and
Jean?
If I sent it to Tom,
yeah, she must have it. Yeah,
Do you want to send it to me and I'll make the corrections,
sure.
or?
Yeah.
Or how do
Because you
want to do it?
did this just from a piece of paper, you didn't do this on the
Correct,
document.
right. From what
Okay,
you
so
sent
I'll
me,
have
right.
to go on my computer,
You just send it
and
to me
then-
sometime,
yeah,
okay,
They looked at
I'll
the,
just-
the qualification, the job, for the job. The working job, that seemed that was pretty good. It was more the application where people need to find out about what the requirements are. But I also added the salary range in there, which
right,
wasn't
but
in the original.
with generous employment benefits, like what?
Oh, we have really good employment benefits. Yeah.
You do?
I could go into detail if you want.
well, you have, partial insurance. You have paid time off, you have vacation time.
Every
So
holiday.
salary range
Holidays.
up to 70K depending upon,
Qualifications.
yeah,
Yeah. But you're in, like Hampden County Retirement,
okay,
there's
Yeah, I think it's
There's
a pretty good
benefits.
package, yeah. And I
Yeah.
think they pay
holidays.
50% of the cost
50%
of
health
medical.
insurance.
so should we
Health
say the
insurance?
salary range is 60 to 70K depending, not up to, just say 60 to 70K depending upon qualifications?
Yeah,
And I'll have to figure that out. Okay, so yeah, send it to me whenever you can, and
okay.
any other changes you see on here, Tom?
No, it's actually. No, I went through that pretty well. I thought it was
So it's just basically the abilities and
Just,
the knowledge.
making it so they, as opposed to having them, being able to acquire them. And as I mentioned to you, I think the last meeting, I would be more than happy and able to mentor a person that lacks any of those,
Okay, should we vote on the changes now or wait till we make them and then vote on them, or then have another two weeks?
Yeah.
Right,
So should we just vote on the changes now?
I would think,
All right, so one motion,
yeah, I'll make a motion to implement the changes in the job description for the health director. And once they're implemented, we'll get a final draft and then post that,
And Tom will post it.
and Tom will post it.
The same places that were posted originally?
Yes, anywhere you can post it.
Okay, yeah, MHOA,
Yes.
papers,
Any, you know, public entity, any health related office
okay, Yeah. okay. I
Okay,
think
that's my
Mackenzie
motion.
mentioned you might have you had some good ideas when we talked about this before about, we could maybe share this.
Yeah, get it out on social media might be
Yes.
right,
Yes,
right.
targeting a younger demographic. Oh, but anyways, I'll second that motion.
sorry.
Okay, all in favor?
G. Nielsen, yes.
Mackenzie, yes.
Sue, yes. Sue Broski, yes. Okay, so,
So I'll send it to you, Sue. I'll send it to you, you update it, then you send it back to us.
everybody,
And then we'll send it to Tom as the final for publication, okay? Will that work, Tom?
It certainly worked for me.
Okay.
okay. That takes care of that one. While we're on hiring, what's going on with our Board of Health secretary? You know,
Well, I saw Jessica today. She's still working. She's
Mm.
getting the permits out, and we have she's gonna provide us a list of some of the problems that we have from certain folks regarding not getting their documentation in before January 1st. As I recall, years ago, there was a
you're still.
resolution,
Right.
regulation that you put in about if people didn't make it by a certain time, they
Right.
would be fined. So we're gonna
We
be talking.
can't enforce that because we didn't get the permits out in time.
Okay,
You know, Jessica's still working on getting the permits out. We can't fine them if they haven't.
Oh,
gotten them
absolutely not.
before
But I'm talking
January.
about the ones that she did get out,
The ones that she did get out,
and the people
yes.
still haven't sent their money. Or information like ServSafe. I'm talking about the ones, yeah, you're absolutely agree with you, but ones that were sent out a while ago and they still haven't done anything. You still feel that
Okay.
way with that?
Then we need that.
Yeah,
list
she's
from
developing. I
Jessica.
saw her today. She's
Okay.
gonna, I mean, it's not many, it's just a few.
Yeah, but those need some type of enforcement.
So Mackenzie, you agree?
Sorry. Yeah, I agree.
Okay.
okay.
So we'll
thank
get
you.
next time, for the next meeting, certainly Jessica will have that, and because she's still working on it. And getting information from people that haven't submitted not just their payment, it's also, they haven't submitted their ServSafe certification, and things like that, that they need to do. Choke saving, things like that. For example. Give Sue a chance to catch up.
Okay, but how about a secretary? Have you heard anything from Russ Fox or anything about a Board of Health secretary?
No, but I did hear from Carl regarding, there's a senior placement based out of Springfield. And that there was a person that was in conservation several years ago that Carl said that we should look into. This person could work, I think, up to 20 hours a week. So
That's on a grant.
yes, but it's right.
So it wouldn't come out of Board of Health budget.
Correct.
Okay, let's start next meeting. Let's,
Yeah, okay.
by the time, this person's a senior, they're gonna be gone soon.
Right.
Right?
Yeah, I don't know what the age is, but
So
They're
they
seniors.
have somebody in mind?
no.
or-
You'd hire. No, you'd have to approve it.
Oh, by the time we do all that.
Well, no,
they'll be-
I wouldn't say it
they'll
would
be
take that.
graduating.
Huh?
Really, by the time we come to, but we get the information, we have them come to a meeting, We
We do
interview
an
'em.
interview.
you
we
hire
talk about
'em.
How many people are there?
And
Are
then-
there many applicants? Are there,
you
give
know,
us a hint.
they'll be,
You talking to me?
They'll
I
be
don't know.
graduate- they'll be
I have no
considered
idea.
men.
This is a new program. I mean, it's a new
Yeah.
program for me.
Yeah.
Carl just suggested, and I got a contact from the person that runs it in Springfield.
all right.
So
can
I
we
can-
get somebody here?
Next meeting for
Well,
an
even
interview?
before next meeting. I mean, I'd be willing to meet next week if we could interview someone and hire someone. I don't know about how you feel
Yeah,
about it, Kinsey.
See how
I
they
can- I
they
can
do
fit-
that.
I can fast track it as fast as
Right.
we can do it.
See how they do it. Do they send us one person? Do they send us 6? Do they,
That was just one thing on
Yeah,
my horizon.
Yeah.
I mean, it's
Yeah, I know.
important, but it just
Yeah.
I know. you have a ton
COVID,
of stuff, yeah.
COVID is,
Right.
so yes, I will
Yeah.
try to get,
just
try to
some
get
more
it.
details on.
Yes.
on-
Well, I just got the details myself, and
Yeah.
I mean, I haven't downloaded the details, but well, from just what Carl told me, it wouldn't come out of our budget, it wasn't come out of the town's budget, and it's a senior program. I said, the person that
Right.
was there before you was doing. it.
Okay, what do
So,
you think, Mackenzie?
Yeah, I can make myself available next week. It might be virtually, but I can be present for an interview process if we can set something up.
Okay,
Yeah.
I'll work on that, try to get something fast track, sure, yeah. But in the meantime, even
What's-
before that, Jessica's been,
So what is
Doing
this,
her work.
organization called?
I have it on my computer,
Do you know?
yeah, I get,
You gotta
it's
be
like,
later.
it's based in Springfield City Hall. It's a senior related program, I can check in,
I can get a, we can get.
I have it on my
that's okay.
computer, I
Yeah,
can,
I
I
get
can
it.
get it for you, and
Or
I'll certainly have
send me that email.
link?
or something so I can
Yeah,
put it in
that
the
link,
minutes.
okay,
Just a senior.
I mean-
The senior program.
senior employment,
Senior
Program.
employment program.
Senior, high school senior employment.
no,
No.
no, no,
No,
no.
these are 60.
These are, no, these are
older.
senior.
Oh,
Yes.
oh.
Oh,
okay.
I'm sorry, I thought, yeah,
Oh,
no, when you
that's
said graduated,
That's
now
why
I
I'm
get,
saying we're gonna
no,
graduate.
no, they're not graduating,
Oh,
no,
all right, so
No,
therefore, it doesn't
yeah.
have to be rushed.
No.
They're
right,
senior citizens, not
Yes.
senior.
yes,
That's
right.
Mackenzie,
that's
you
right,
got
not
it.
senior. Yeah.
I mean, Mackenzie, did you know they were senior citizens, or do you think they were? senior
Yes, I very much knew they were senior citizens.
Oh, okay,
I knew that.
so when Sue kept
I
saying,
thought it
yeah,
was-
I know, when you kept saying, well, they're gonna graduate, and
Okay, so
Why?
therefore, it doesn't have to be.
Yeah,
Okay.
graduated,
Oh.
yeah.
oh, that's good. So
All right.
does
so-
that change your thinking about the next,
Yes.
so try to go for next meeting?
But yes.
Yeah, the
but
next
if you
meeting,
get
it's not
some
a rush.
details,
Yes, oh, no, I'll
You
get
know,
all the details,
who the
now I get
people
the,
are, who
but
you get to pick,
I just
you
wanted to
know,
make
yeah,
sure that
yeah,
you folks were
yeah,
okay with it
yes.
before, because this has only came
Yeah.
up the last couple of weeks and
And
I've been
hopefully,
busy.
see someone from Springfield in the wintertime.
Well, no,
But
the-
no, it's based.
That's based in
but
Springfield,
there are
because it's
people
like,
all over,
you know,
yeah,
yeah, it's
no.
people
Somebody
all over,
hopefully
so
in the
we'll
same
get,
area.
absolutely, they'll probably
Right.
match you with, they'll probably match the person that lives nearby.
Right,
you
so
know.
if you can send me that email you have, so just so I can get the proper name.
I
of the
absolutely will,
company,
yeah,
okay.
I mean, it's right on my computer right now. It's
You
on
guys
my
must have thought I
email.
was in- you must have thought I was insane.
Yeah, well,
Gonna graduate.
Okay,
All right,
all right, I skipped over one, the housing complaint, 810 College Highway, which I had discussed earlier, but just want to let you know, I sent that, the notice, the violation notice to them, a correction notice, as well as a copy to the tenants, and CC the building and electrical. Typically, the Board of Health with the building department, if there's like a, for example, if there's a fire, someone's house, they're not moving, but they have to vacate the house temporarily while it's renovated. It goes on a lot of times. So you have, sometimes the trailer, a firm comes in, there's a company called American Oval, and they come in and they do all the connections and make sure the plumbing, electrical and stuff. Well, that's what we're requiring of them because they're doing it without any permit. So that is why we sent that letter. And they have also a lot of debris around the property. So I cited it for that too.
so, okay, so they're doing renovations there, but they haven't gotten any permits. Is that what it is?
No, what I was saying was if a house,
Right,
typically what happens if the house was burnt, and it wasn't demolished, but they needed, no structural damage, but, it was it was gutted. It needs to be, they can't live in it while it's being repaired, but they don't want to live anywhere else. So this company comes in, probably, insurance related. The company comes in with a trailer, a nice trailer. And then they hook up with getting the proper permits from the building department to make sure, the structure is safe, electrical and plumbing, and, it's connected to a sewer or a septic properly, safely. Well, that wasn't done in this case. That's why we're requiring them to do that. They have to get the appropriate permits while they're renovating this house.
So
Yeah,
what,
because we got it on that Fort Crescent. They did a
Exactly.
trailer. but
That's
they went
exactly
through
the analogy.
permits, they
Yes,
got-
but in this case, they
yeah,
didn't do
but
that.
They didn't, so.
Yeah,
so
so,
you sent them a letter?
yes, I sent them a note.
What did the letter basically say?
Yeah.
It was a violation letter.
A correction order with a,
A
violation
correction
for, only the Board of Health can approve temporary housing. A lot of people are confused about that, but we work with the building department, but only the Board of Health can actually approve that. So they were in violation of Article 2 of the State Sanitary Code.
For temporary housing?
Right, they don't, so the violation would be, besides the rubbish and debris around the property, violation of that number, and I can't remember offhand what number it is, but they didn't receive written permission and approval from the Board of Health.
Okay.
Ready for me to continue?
Yep,
Sue?
Yep.
Okay. Kind of skipping back to the people things that are happening in the community. Sodom Mountain Campground is either sold or in the process of being sold. There's going to be new owners taking over. So they have come in and, I've talked to them, they're going to be coming in to look at the plans on file. And from talking to, they're out from the eastern part of the state. They're going to be doing some renovation there, putting some money into it, basically, and upgrading the facility according to the people that I spoke to. So, so I'm going to keep it, obviously we'll keep you posted on that.
is the one on College Highway still?
Yes,
there?
not that, right. This is just Sodom Mountain
Sodom Mountain.
Campground. Okay, we got a few more things. Okay, as you recall, Valerie was doing contact tracing, and I reported that we were going to be in deficit spending. The good news is, when I went down to ask for finance committee paperwork to the deficit spend, or basically it's a transfer from the emergency fund. Turns out, after talking with Laura Fletcher, accounting, found out that she was taking it from an account for Pioneer Valley that had a grant had been given, which I didn't know anything about. So obviously I didn't know that. So that was good news. So most of that money, with exception, I think $400 out of that was taken from another grant. That grant's now closed. But the good news is if you look at I think I gave you
The budget.
budget, and Mackenzie, you might not have a copy of this, but I can read it. Normally it's $3,000, and I thought we were deficit spending, but we have $1,633 left, $1,633 left. So Ashley, she hasn't been required to do that much now, so her number of hours that she's submitting has drastically reduced, and I basically stopped Valerie from doing any more when I heard about this, originally deficit spending. So that's good news. The grant that is going with there's two grants going on, not counting the one we just had. So there's the nursing grant, which I'll talk to about in a minute, and this grant about the contact tracing. The three towns are West Springfield, which is the home base, Agawam, and Southwark.
That's contact tracing.
Right.
And
So that's a separate grant, and
do we have any more money in that grant?
no, that's the one that was in our town, that money that we paid Valerie out of.
All right,
This is something that they're the fiscal agents is West Springfield for this one. So they have two people over there that do contact tracing. They were pretty much overwhelmed.
and they're getting paid from a grant that was from our three.
Correct.
towns.
Yes, yes.
And we still have money in that grant.
Well, yes, because they're still working. And besides that, the contact tracing, I just got an email from Gene Galloway that said that the new contract requirements have loosened up the types of contact tracing you have to do. So they're, instead of calling everybody that tests positive as they were doing before and all their contacts and
Yeah.
early on, not only did they stop that, they're focusing on large scale nursing homes, daycare centers. So they're not going to, so that's going to really reduce their workload. Okay. So, but we could possibly, if you wanted, if the board's pleasure, if you wanted to continue contact tracing, I can still pursue money from ARPA, which is the American Relief Plan that by Congress had set aside for COVID type,
Right.
not just COVID type relief, not just COVID relief, but it's one of the factors.
All right,
Carl's also pursuing something for buying
all right, so we have to
antigen
we have
test
to
kits.
decide whether we want to continue contact tracing with all these kits and people are gonna be at home testing.
Yep.
And no one's gonna, and supposedly it says if you test positive, you're supposed to contact your physician, but
Right,
what are your thoughts on that, Mackenzie?
you're the expert in
I
this.
mean, I don't see a huge benefit from it. It's just going to be very disjointed. You know, if we're handing out all these home tests, then it's kind of.
We're losing you.
You there?
Can you hear me?
Yes, now we
Yes.
can. Yep.
Okay. I don't know if it's going to carry much weight. You know, I don't see if there's necessarily a huge point of it. If there's going to be, it's such a disjointed process. If it's necessarily worth.
Yep, you faded again.
Huh?
You faded again.
Well, that's so weird. I don't know why.
No, you're good. You're good.
Yeah, I don't see like a huge point to it, but I'm open to other suggestions. You know.
Well, let me ask you this. What's happening, a byproduct of the antigen home test kits is that, you know, some people are taking them and testing positive or negative or whatever.
Yeah.
But some people taking the testing positive are concerned and calling the Board of Health for advice. So I think
Right.
there should be maybe a policy where, because we have some issues regarding the you know, the accuracy of the test and who's testing whom and things like that. But I don't have a lot of information other than what the contact tracer would give, but those are for tests that are
Positive.
go into Maven.
Right.
So the contact tracers are normally their responsibility. So these antigen tests that are going out, we're going to be getting more of them at some point, whether they're from the town purchasing them directly or President Biden's purchase of 500 million of those kits. That's going to add a lot of information for a lot of people. And DPH is on their website says, you know, if you have any further questions, contact the Board of Health, which we're getting a lot of calls. And in talking to my people in contact tracing world, they're saying, well, we don't follow up on those because the reason that Sue mentioned earlier about those home tests. So it'd be nice if we could either discuss or develop some kind of a policy, so what we could tell them
Mhm.
consistently and uniformly that would
In
allay
the
any
package
fears.
insert, it says if you test positive, I believe it says to contact
Yeah.
your
Yeah.
physician.
Physician,
Yeah.
Yes.
yeah.
We should, our policy should honestly be to direct them to their primary care provider.
Yeah.
Right.
Okay.
Urgent care warranting the symptoms, but as Board of Health members, you know, we may lack some of the credentials to be advising these people anything other than seek a healthcare provider.
Right.
Yeah, it's just
I agree.
unfortunate that
Yeah.
DPH put that on their website, so we're all, not just us, we're getting inundated with calls from people that didn't take the PCR test and are taking the home to COVID test.
Well, if you want to take the person's name, phone number and forward them off to Ashley, I'm not Ashley,
Valerie,
Valerie. And
Well, I
then
have done
have
that a little
Valerie contact them and say, you
Yeah, but
know.
Valerie's not a nurse either. I think
No.
we should just say if you're positive, contact your primary care provider.
Yeah,
Right. I mean, we can have definitely the latest recommendations in front of us, but I think even to advise them on the latest recommendations would not be our best move.
right.
You know, to advise anybody on their health over the phone, I don't think is great practice to start with.
We're not nurses.
Yeah, no. And if you're honestly sick, if you broke a bone, you wouldn't. Well,
True.
You need to talk to your physician. They're the best ones that'll give you the most updated information and probably the best course of action
Yeah.
for the condition.
something that would be
Well, Mackenzie, you know what your primary care physician will say? They'll say, go to the ER.
That's probably true.
Passing the buck.
They hold the liability insurance, we don't, so let them say that.
Yeah, because we get calls that, let's say a call would come in and say, well, I live with somebody that, that tested positive 5 days ago and now I want to go to work and what
Okay.
should I do? Those kind of questions, and
Right.
it eats up a lot of time and there, plus it's a home test that the person got. So I like the idea about the referral.
Yeah.
If we do it consistently, we're going to get some pushback from people that, want their answers from, but
Well, also, see, we have the site for the CDC guidelines. You can
Yes.
give them that site.
I do, and I have.
All
yes.
right, and give them that site for the CDC
Sure,
guidelines.
okay, that's great.
Okay.
Well, that,
Also, they can contact their employer because their employer may have their own,
Right.
They're like occupational health or something, yeah.
yeah. But you know what's frustrating with and I'll tell you, with the Bay State Health System, you try to call your primary care physician, you can be on hold for an hour,
At least.
maybe more.
really, yeah.
Yeah,
Yep. So you put your phone on speaker and just lay it on the table.
yeah, and
next
then
to
walk
you
around, but I'm
until
just saying, like,
Somebody
people
answers.
can be very frustrated.
Yes,
Yeah,
Yes,
it's just a systemic issue, but I also don't think that it should be a Board of Health
Right.
issue, not our issue, just we should not be advising.
Yeah.
And I think we should
Agree.
implement policies to refer.
yep.
So Mackenzie, you want to make a motion then, if we get calls, this is how we should handle it?
Yeah, I'll make a motion that the Board of Health should be referring COVID-related calls to their primary care providers and providing the latest update link to the CDC website.
okay, good motion. I'll second that.
All in favor?
Mackenzie Kane, yes.
Jean Nielsen, yes.
Sue Broski, yes.
Okay, good. That takes care of that. That was, next two things I have is a
So,
nurse.
for
ahead, Sue.
Karen then, you can just write it out and tell her what, and have the site there, is that what she does? Have the CDC site? for-
I can
for
tell her
when she
that
gets
now.
calls,
Yes,
okay.
I mean, we were referring them to the contact tracers.
Or
Uh,
you even honestly just have a prompt that says, I'm going to refer you to the CDC website. Go online and look it up. You know what I mean?
Yeah. Sounds good, like that. Okay, update, nursing.
It's possible when you tell people this week to go to CDC website, and then when you tell them in 2 weeks from now, It's probably gonna change.
Well, that's true. I mean, we have a meeting on Tuesday, DPH meeting, and it's going to be devoted to question and answers from our colleagues. And that was a question I was actually going to bring it up. What is your recommendation? Because DPH has that on their website, which is what prompted me, and the fact that we're also getting calls about that very thing. And so, that policy sounds it's very straightforward, and I think it'll work. Anything else on that topic?
No, I'm all set.
Okay.
Jean,
Yeah, I'm all set.
Okay, the last thing I have in my thing is the nursing grant update. As you know, there's the different grant that we haven't received the money yet, but I
Oh,
do
wait
have
a
it.
minute. Did we decide contact tracing? Did we vote whether we're gonna stop it?
No, we did not. You guys did not.
I'm against doing any more contact tracing.
All right, I'll make a motion that we halt contact tracing.
Okay, I'll second that motion.
Okay, all in favor, Mackenzie Kane, yes.
Before we do that, though, we don't have any nursing homes in town. I'm just thinking in what situation we would want to do
Contact tracing.
that we may want. to.
Actually not in the height of this ban, like right now. Maybe when it kind of calms down like it was. I don't know.
Yeah, there's just way too many people, too many home tests, too many non-reported. The data is just it's not accurate. You can't depend on any type of numbers right now because of all the variables. So, I don't think the contact tracing really is doing anything for us.
Tom, so is West Springfield still doing it for us, or they're just inundated?
Yes. So you want to say that they don't have to do it for us anymore? Is that what I'm hearing?
So, yeah, but if there's grant money, then where does that money go?
Well, they'll usually get to those people fast enough, or
Do you know what other towns are doing? Like is Westfield still doing it, Granville, Tallinn?
yes. Yes, they are still doing it. Granville and Town definitely. So Valerie is the one that's doing it for them.
She's contact tracing every single person that,
No, it's different now, the guidelines.
Well, she calls every positive right now. Yeah, I mean, she's doing it the old way, but that's actually separate. She's not working on this grant. When I'm talking about the grant that we have with West Springfield and Agawam, the new guidelines from that grant are saying that they're focusing on larger scale things that I mentioned
Right.
earlier.
Which we
Okay,
don't
so
have.
in other words, that really should reduce those people to be, they had 1,000 in the area, 1,000 cases in the three towns, most of them in Agawam, West Springfield. But so they was totally overwhelmed their ability to phone, even if it was just one phone call. If they need to get a hold of somebody, at least talk to them if they can possibly do it. So that still takes a lot of time.
Yeah, well, the only thing I'm concerned about is the schools, how that all works, or do the schools handle that?
the schools send out
Yeah.
the notice and
They
say
do.
how
Yeah,
many
and they have,
cases
Marcia
in each
Lamro was,
school.
They
Yeah.
do?
Marcia Lamro's following up with the school
Yeah.
kids, so we do
Okay.
have, that's a
Right.
Yeah,
And
they
then what
send
other-
out a weekly notice.
Do we have anything else in town that would involve?
American Inn, maybe, a large facility.
And we don't know if there's positives there, because
Right?
Yeah.
We don't know.
okay, so I'll second your motion that we halt the contact tracing, basically due to the home test kits and everything that's going on. But we may want to revisit this
We can
in the future.
in
Well,
the future.
Well, what if, put it this way, what if since the people, since the new grant guidelines have reduced the amount for in targeting certain sectors now, it would be, we could still be in, without stopping it completely, they would still be able to do it with the same things, like if we had a nursing home or elderly project or something like that. I mean, if if they're now able to get it under control because they don't have to do these, they don't have to do the single ones anymore. And they're not, if it's not a Maven, they're not hearing about it anyway, unless the person that tests positive goes to their doctor, gets a PCR or, right? So,
Well, if you think about a medical facility like a nursing home, you think they have the personnel there to
Yeah.
essentially take care of their own contact tracing, you know, with their own patients.
okay,
And their
All right.
patients have got to be under a physician's order anyways.
Yeah, we don't have a nursing home.
Yeah. But, you know.
there was other
facilities like that.
daycare. Yeah, there was other daycare, or if there was a large, let's say. you
Well,
know, a-
daycare,
a
like,
rest-
like the kids, daycare that way. you
Right,
mean?
yeah,
Which we do have those.
right.
Right.
So these,
And I know, so with daycares, they would do that.
so my question is, what do you want to do? You want to just say we're no longer needing to participate with West Springfield? I have a meeting on the 20th with them. Again, a Zoom meeting with Agawam, Southwick and their contact tracers. You want me to go ahead and tell them now or wait till the 20th meeting? Just give me some direction on that, because I want to make sure we're not.
Yeah, because I didn't, I guess I just missed Tom's first part of it, they're just doing contact tracing for the larger facilities, as opposed to all the individual ones.
Yeah.
So maybe we should stick it out for a while and see what happens. And since we do have the grant. we don't
Yeah,
know
it's
how much
not
more-
right. We
don't know
wouldn't
how
be
much more
paying,
money
we
we
wouldn't be
get.
paying
We
Val.
don't know how much more money we have in that grant, do we?
Well, then let's wait till the 20th for your meeting.
Okay,
Okay,
fine, sure, that'll be,
all right.
okay.
So
Okay.
do we need to vote on that? No, because,
Okay, that's all I have.
Yes.
wait a minute.
Can I add something?
Yes,
Sure you will.
Traditionally, the budget hearings are held in February. That's like 2 weeks from now. Have we gotten anything
No.
from accounting
No.
on the budgets?
No.
The fiscal year budgets?
No.
So what are we supposed to do?
I don't know, maybe it's not gonna be, I can check on it, talk to Laura.
Yeah. Because I haven't heard anything from any of the other committees
Oh, I did have one thing,
or boards, so
okay,
can
I'll
you check?
check with Laura. I just gotta backtrack, because I do have one more thing, and that was the nursing grant, and I started to talk about that. Just that we still haven't got the money, but Rachel Kane, that is the DPH Policy and Planning and Operations person from Mass Department of Public Health, has replied. I reached out to Tammy and wanted to get an update from her, and she reached out to Rachel, and she said the contract is with our fiscal team, and it would be a couple more weeks until we see it, but I think it's a great idea to prepare the job posting so they can be posted as soon as Southwick is comfortable with doing so. This is for the nurse and a half
yeah.
position. Mackenzie, remember that Tammy applied for?
Yeah.
Right. Yeah.
Well, you guys applied for it, so we technically still don't have the money, but
Yeah.
but obviously it's a done deal.
We're not ready. We have no place to put them.
Yeah,
So we wanted to talk with Russ Fox about the other
Oh, we could still, yeah,
desk
we could still,
in
yeah,
that room
yeah.
to put them in there, but I don't think, or do they need a secured area?
I would imagine they need a secured area. I mean, that's,
Or-
well, when
I
I,
don't
think
you know
it's
what, I
secured
broached that subject with Tammy, and her impression was that the nurse would laptop and online and not having necessarily a physical presence. Was that your understanding?
yes.
It was.
No physical
That,
presence?
no, they would be a physical
No,
presence.
that's what,
Really?
yeah, well. I don't know, that's what
I would kind of like to have a little bit.
Especially
of
if she's based
physical
here.
presence.
She's based
I'd like-
here.
Yeah, if she's
Yeah.
based, I'd like to
Yeah.
have her
I,
place.
Yeah.
I don't disagree with you. I'm
Yeah.
just saying what this is what Tammy, that was
Yeah.
her thinking at the time.
Yeah, well,
Maybe the part-time nurse who's going to be floating around.
For the other three towns, correct?
Yeah, but
So it's a town in Granville, Southwick for the full-time and the half-time for the Montgomery, Russell and Blanford. And we still got to get together and the six of us and kind of waiting for, well, we're kind of waiting for the money to come in. That was probably the
Right.
big thing. And then get together with the six towns and
do some kind of
hammer
job
out,
description.
finding out where, but I don't disagree. I think it's a good idea. Mackenzie, what do you think? Nursing thing about having a physical presence here, at least.
I mean, yeah, I, at least some of the time, yes.
Yeah.
Instead of just solely working from home.
Yeah.
I mean, even if it's one day a week office hours, I think that somebody's got to be
Yeah,
there.
I think other towns I've spoken to want to see the nurse too, quite frankly, and have some
Is there-
kind of hours, even if it's 2 hours here or 3 hours in that town one day. I think that's the kind of consensus I'm getting from the people I've talked to.
Yeah, I definitely agree with that.
But in finding a location, I would work with Russ on that. I think the location where which we used to have the desk there before, would make a lot of sense.
Where they're
Because
taking
it's
pictures.
now used for something that we hardly ever use, which is the badging. And that could be either put into another area because it's portable and put a desk back there. I
Yeah,
think that would make so much more sense. And I'll approach it with, I'll do that myself,
Okay.
Russ, okay?
Yeah, we have to do something to be ready for that.
Okay,
And when you get together with the other towns.
yes,
We'll have to come up with a job description
well, we have a job description,
You do.
but I mean, at least,
for the part-time time and the full-time.
I think they're similar. I mean, I looked at them briefly, and I have them in my, in the folder. That must have been passed out to you folks at some point when she was applying. Tammy, you probably must have looked at it probably. Anyway,
went through
I do
myself.
have those.
Yeah,
I do have those,
I
and
looked at myself, I haven't seen it.
okay. I will get, how about if I get you I'll get you all a copy of the job descriptions.
That'd be great.
Okay. Any questions? That's all I have. I mean, all of you. For tonight's meeting.
Update on DPH meeting.
I'll tell you what happened last Tuesday at 3 o'clock, 3 to 4 o'clock, we have a meeting. And they had canceled it because of the holidays. And at the last meeting, it wasn't focused solely on COVID related issues. And there was some other issues that I'm trying to think of it wasn't so germane to the smaller health departments, but there was so many questions regarding the problems we're having with COVID and masks and things like that. They said, listen, we're not going to discuss any more about this right now. We're going to devote the next meeting, which is Tuesday. That's why I said I would talk about that at our next meeting, because there's so many questions people have, not just us, about what's going on DPH. So they're going to devote the whole meeting just to question and answer period, which I've actually never experienced that before. So that'll be Tuesday at 3 o'clock, which I will attend. So the other meeting was, they talked about some things, fentanyl and some of the other public health issues, but not directly related to COVID. So that's really so they really bypassed that and said, listen, we're gonna combine them next week, next Tuesday, we're gonna hit it hard. And they invited us to submit questions early on beforehand. And I was gonna submit that question, but you folks already resolved that about what the response would be COVID for what people call it about testing positive with their own private tests. Well, it should be by 15 minutes.
Yeah. An hour later, you're
Yeah.
okay.
Okay, the mask, so town hall. Mask required, the selectmen voted for that. How about like the DPW? We know the fire does. Police, or did they just do it for just the town hall?
Just so far, right?
Do we want to address the mask mandate again for all of the town
Public
buildings?
building.
All the town, like the fire, the police, the DPW? Is the library one of them? Is that considered a town building?
Yes, it is a town building.
Do we
Yeah.
want to, I mean, you know, my feelings on it, it's just, Gina McKinsey, how do you feel? I mean, the fire already requires it, correct, Tom? Fire, when you went in there,
Yes, well, when I went in to drop off the kids,
and the
Yes.
town hall requires it to the selectmen. Do we want to require all town employees, they can't be 6 feet apart?
All public buildings,
Right, public,
yeah.
well,
Public buildings.
town public buildings.
Well,
Yeah,
you know, essentially a public building is an entity of the town.
town. I mean, has anybody's thoughts changed as opposed from the last meeting?
My thoughts have not changed, no.
Okay,
Yeah, see, I have no problem requiring it in public town-owned buildings. Library, police, you know,
Well, you
if
can
the
enforce it.
selectmen mandated that it's in this building, what was the reason they did that? Is because people in this building tested positive. Okay?
Yeah.
So if they're requiring a mask mandate, which obviously they have, you can't be up and in the hallways or at your desk, you know, unless you're 6 feet away from somebody. They have to adhere to their rules. You can't have employees standing next to each other without masks on. So, you know, if the Board of Health wants to enforce that in public building, it's in all situations in the building.
so it would be police, fire, DPW,
DPW.
library, right? It's library.
Right.
Um,
But you wear a mask regardless.
Now, what's that gonna, we can easily vote for that, and if we vote for it, and then it can be in the newspaper with Peter. But what does Tom have to do? He has to, do we have signs somewhere stored?
Well, Tom's in this building. Tom sees people in
No,
this
but
building.
he'll have to notify the library, well,
Right.
police and fire, and DPW. Do we have those? Tim used to have lots of signs that you had put out everywhere. Do we have signs?
yeah, I can get signs.
Yeah.
That's not good, that will be an issue.
Okay,
Okay, so if people in these public buildings are mandated to wear masks, even if they're sitting at their desk or sitting in their office away from the people, do they have to wear a mask?
no, if they're 6 feet away,
If they're sitting at their desks, they're in this building,
and if they're
if
6
they're
feet
sitting-
away.
and usually have petitions in front of their desks.
I think we just take the one that, that Carl sent out to everybody. And we just enforce it for all the, it's right here.
Okay, what does that sign downstairs on the door say? Masks are required in this building.
For children, yeah, except for children, over
Right,
5 and over.
but it doesn't say unless you're 6 feet apart from somebody or unless you're sitting in your own office, et cetera, and on and on. Is it a general
It
rule
says
for
here,
everybody? Or
staff would wear masks when they are not at their workstations and while circulating or walking through the building. So if you're at your workstation and if you're 6 feet apart, we need to add that, then you won't need one. But if you're walking or circulating, then you need to.
or if people in the same office are standing, looking at a computer screen together,
Well, because you're working at, yeah, you're not.
Right,
security part.
you're not at your station per se.
So it'd be basically what, I think you forwarded it to me, Tom, from Carl. And we just have it go into effect if we do it, say Monday. Tom will be back on Monday.
Yeah. Yeah,
Do you think that's easy enough to work out, Tom?
Yes,
okay.
you're gonna formalize that?
Now, the other thing is too, enforcement. I mean, we're not. Are they gonna enforce it at the library? And the DPW?
Well, that's just it. You can say anything you want, but there are no mask police. And it's not proven that masks stop the virus from spreading. I mean, they're a help, but they're not 100% guaranteed not to spread. So, I'm all for people wearing masks. Obviously, we're all here, we're all wearing masks right now. I'm for that. But you can't enforce it. You can tell, you can send out a notice, create signs, but there's still no enforcement.
How's Westville handling it, Tom?
Strong in recommending their mandate is still strong.
Yeah.
Pretty much what Gene said.
But
Well,
were they talking about fines or something?
they're talking about, but
But who's
I think
going to
South
do
Hadley
that?
was,
Police.
South Hadley was gonna find. And I don't know how that's worked out. But I
Yeah,
know they-
are we expecting, like, we're gonna call the police on our coworkers? You know what I mean? Like, we're kind of creating it,
No,
No,
no, that's it. Yeah,
like,
But-
enforce a fine.
they have to
Right.
police themselves. If
Yeah,
you see an employee walking around the hallway without a mask on, somebody needs to say something to that employee. So, it's kind of a brother watching sister type thing.
See, the town here, they're hired, they're working here, you can go to their superior. The library, you have a lot of people coming in, and I'm just worried how they're gonna, enforce that.
Again, it's.
Yeah.
And I don't want,
You know-
and I don't want things to get ugly.
No,
Well,
but if you're.
we're asking our town employees to be police officers of masks. It's gonna get ugly.
Yeah,
That's just the reality of it. And I can tell you, 90% of the people would not say a single thing to somebody walking down the hall without a mask. Because they wouldn't. They don't have the courage to. And it's gonna create an uncomfortable workplace for our town employees.
well, the town employees should be considerate towards their fellow worker too.
Yeah, I agree.
Well, they're already wearing masks at the town hall. The selectmen already put that in effect.
Okay.
And the fire department, I believe, also. Tom, you saw that, right? When you went to the fire department, they had to wear masks.
Yeah,
so-
first responders have to wear masks.
Yeah.
Right, and if the librarian's there and somebody comes into the library without a mask on, I'm sure they have masks available
Yes,
to give to the public saying, you have to wear a mask. You don't have to go over and tackle them to the ground and force it on them.
Yeah.
But, give them a mask, you have to wear a mask in this building. And if they choose not to wear a mask, they can leave the building. But if they're in the building, they really need to wear it. Okay?
Any comment, Tom?
just to follow up on what Gene said, if someone's in a building and they don't have a mask on, which I've seen, there's not a lot of, enforcement, but that can be done. But I think most people would wear a mask if it's, you have a public health mandate from the health department, or or the Board of Health in this case. But it doesn't preclude people that just do not want to wear a mask, and maybe some of them have a medical issue, they have a medical exemption.
Why do you want to word the motion?
I don't know. I really don't. Mackenzie, what's your,
She doesn't.
I will not bring one forth, no.
She's against it.
then it's mine would be that the Board of Health highly recommends that all public employees in public buildings and visitors to those public buildings also need to wear a mask. It's a recommendation.
Doesn't that say that already on a lot of
Well,
places?
then you're just repeating what's already been said, and you know, people should have enough, you know, concern for themselves and others to do it.
You know, why do they say 6 feet? You cough or sneeze,
Yeah.
goes up farther than that.
And why do they say 5 days? Does the COVID virus have a little watch that it wears, and then after 5 days it goes away, you know? I mean, what's the timing issue? What's the distance issue? What's the mask issue? There is really no 100% control of the virus because it's so varied.
Because they don't know.
Right, nobody knows. So that would be my suggestion, is just that recommendation. Sue, it's up to you.
I think we do this, Carl said, where they highly advisable. Which I think there's signs anyways. That's what, how Carl did it. To wear a mask. Which we already advise people that.
Right.
Okay, so you already have signage. What does the signage downstairs say?
That anybody over the age of 5 has to wear a mask.
Okay, so I make a motion that we follow the town hall's guidelines for mask wearing in public buildings for employees who are not at their workstation and are not 6 feet apart from other people. And for any of the public that comes into those buildings.
I'm getting lost in this. Is this only for the town hall?
This is for the town bill. This is for the police, fire, DPW,
Every town
town
building,
hall, and library. And they're already doing it for the town hall, and they're already doing it for the fire. That's my motion. Do I hear a second?
I'll second that.
All in favor? Sue, yes.
Jean knows, and yes.
Mackenzie, no.
Mackenzie, no?
Mhm.
Okay.
But it's 2-1, so it's
Yeah, but it's, you know,
see, but it sounds like it's still a strong recommendation.
It's a
not-
strong
It's not really a
recommendation,
mandate
but-
either, so it's not really
but
a
there's
mandate.
still, there's no enforcement.
And hopefully people will,
And yeah, hope, you know, if you have a concern towards your fellow employees, wouldn't you want to? You want to protect yourself. You want to protect them as well as yourself.
But what I'm understanding is that you're requiring, does the town hall have a mandate right now? Because I'm all against, or I'm all for strong recommendations of being healthy, yes, of course, but it sounds like if you're telling people you have to do this or you're going to face repercussions, that's a mandate. That's not a strong recommendation.
There are no
There are-
repercussions.
You're right. So in a sense, even the mandate is even the term mandate, if it doesn't have any teeth behind it, it's really a strong recommendation.
Yeah,
But that's what we're kind of going down a rabbit hole of like, it's black or white, you mandate or you don't. Because we all are for strong recommendations of doing what's best, of course, but you know what I'm saying? Like, I don't know where we're,
It says here for the town hall, it says highly advisable.
That's what you.
Yeah,
Yeah.
the staff.
Yeah.
Should wear the masks at their workstations and circulating walking through the building. And that there is signage out front. And it does say that some customers who do not apply as we do, there's no state law and there's no board of health mandate behind it. They just want
No.
to keep as many people safe as possible.
right.
okay, all right, yep, I agree with that.
You know, if you care about your health. if you
So it's
care
kind of
about your fellow
like, so it sounds like
employees,
we're kind of
We're in
extending
agreement, yeah.
Extending it,
the
right?
town hall one.
Right.
And as I said, I was at a meeting this morning and one of the attendees didn't have a mask on.
Here at the town hall.
Yes,
So was the meeting with other boards?
yes,
All right, maybe the person has a medical
That's-
condition.
that's a
Yeah, you
possibility.
can't, you know,
That's a possibility,
Yeah,
but nobody said anything.
not even,
No.
higher ups, no. Okay, see, is there anything else that we want to talk about? Anything else, McKinsey, you want to talk about?
No, I think I'm good.
you all set?
I'm all set. Is there any questions from Peter?
Is Peter the only one on?
Yep, Peter, the other one's on.
Right, Peter, you got any questions?
Yeah, a couple. First, with the testing site that you were thinking about doing,
Yeah.
would that be a one-time thing or would that be like a continuous operation
Right.
like Eastfield Mall is?
We're struggling with that. We were throwing around 2 weeks to 4 weeks and see how it goes. In other words, part of it's going to be if they continue to, people still want it and they're still coming and they can get there. We need 200 tests a week according to this for this company. And the demand stays high. I think we reevaluate it, but I think initially we'd be looking at maybe doing it for like 4 weekends, for example, or certainly 4 weeks at certain times. But that's yet to be finalized, Peter.
Okay. And my second question is, do you have the COVID numbers for this week?
The only
There
numbers,
There was 144 on the last report. But then again,
but that was from the 23rd to the 30th of December
I think it was over.
Yeah.
I think
was 144.
Valerie had 208.
For, from what time, I don't have those.
yeah, this is the only one I got was 144.
The
But
only
you
one
know,
I-
those are reported cases.
Yeah, that's what
you
Peter,
know?
yeah.
Yeah,
So-
I know.
It's probably hundreds
And
more.
especially as the mask as the antigen test kits get sent out more and more, those numbers become less,
Accurate.
important and accurate. Yeah. But
Right.
it certainly if they're going up, conversely, if they're going down, that's good news.
Mhm.
But they haven't been.
So the numbers come out when, tomorrow?
Yeah, Thursday, we
state?
posted on Friday. Yeah, Ashley. Yeah.
Yeah, so all we have is from the 23rd to the 30th right now.
Okay.
It's 144 and then, see what the numbers are tomorrow.
Okay. And what about hospitalizations for Southwark residents?
Let me see. Is the tab on here? I don't have that.
Okay, that's okay.
Did Ashley give that to you before? I hadn't seen that.
No, I think Valerie, at least one of the
Yeah.
reports had hospitalizations.
Yeah.
Um, But now we're not doing that type of contact tracing, right? We're not doing the individuals anymore. We're just doing the bigger places with more people. So we wouldn't even know that, would we?
I mean,
Maybe we wouldn't have that information then. At least not for this area, right? When did they start doing it the other way? You know,
you mean which way?
we'll just do like the nursing homes and the daycare centers and that type of thing instead of all the
Well,
individuals or the families.
That was, some of that was started in December. The contract that we were working under
Mhm.
for the contractees was just updated to allow them to just do that. So it's kind of been phasing in. It's my understanding from talking with Jean and her
For contact
assessment,
tracing.
yeah.
But Maven, so that's a contact trace, but Maven should still have the numbers that come in from the hospitals and the doctor's
Yes,
offices.
yes,
Even though we don't have to follow up on all those.
correct.
Yeah, where's that 144 coming from? Is that coming from Maven? Where's that, you
Well,
know?
that is because it's from the state. so-
Right.
Yeah.
So that's the only numbers we're getting is what's being reported.
Yeah. And then if they're only following up on,
Yeah, but even if they're following up on them, we're still not getting.
oh yeah,
those
so that
numbers
144,
reported.
they should know, hopefully, if they're hospitalized or. And Valerie had that information last time, how many were breakthroughs, how many were not vaccinated.
Mm,
Yes.
So that must be all on Maven.
So did we confuse you, Peter, or answer your question?
No, you answered my question. Thank you.
We're just confusing ourselves.
Well, I listened to Dr. Fauci the other day on
Why?
one of the talk shows, no, not the talk show, the news show. And I mean, he talked a lot and I was a little confused
Totally
myself
confused.
and I've been following it.
Yeah.
I didn't have it. I just didn't understand what he's saying and then not to, and I like, he's been, stalwart, but and possibly partly because there's just so much information coming in the CDC and he's dealing with the CDC, the changing recommendations and in the private testing, which is the home testing. There's just a stirring up of a lot of different information that's being fed out and it's confusing to a lot of people,
Yeah.
including, quite frankly, a lot of people in the public health, as I just said, that they're devoting the whole next meeting just to answer questions from all health departments because they're trying to figure this out, what to say, what to do, where to do it, how to do it.
And then a week later, they'll change.
Yeah, well, that's one of the reasons that gets confusing because if
that.
you're,
And then changes every day.
All right, so is Valerie doing anything for us anymore
No.
now?
no, not unless
Okay.
she's
it-
available, but
Because
she's
it would
not.
be nice just to know for our next meeting, when we have those positive cases, if she does have a breakdown, if Maven does provide the breakdown of how many are hospitalized, how many had Pfizer, how many had Moderna, how many had Johnson, how many are unvaccinated. Just,
Breakthrough cases.
yeah, so it would just be.
We could get her,
have
you
that
know,
I
if we
information.
could
think
get her
she
to
did
do,
that, yeah.
yeah. I mean,
Yeah.
she's
Did
good
that
at it.
for
She's
us
on
last
that. She's
time.
doing two other towns.
Yeah,
So
so not
Yeah.
to do the contact tracing, but to get that information
Yeah, just to give us, yeah.
I can do
give us
that.
the info.
Yeah,
I can do that.
that
I
part
can
of it.
ask her to do that. Yeah.
in this next 2-week period.
Okay, hearing no other business, I'll make a motion to adjourn the meeting at 8:35. Do I have a second?
Second that, Mackenzie Kane.
All in favor?
Jean Nielsen, yes?
Mackenzie Kane, yes.